As Chair of the House Ways and Means, I find that due to the state of emergency declared by the governor as a result of the COVID-19 pandemic, and in accordance with House Rule 67 and the governor's emergency order number 12, pursuant to Executive Order 2020-04, this public body is authorized to meet electronically. This is a revenue work session. Please note that there is no physical location for members of the public to observe and listen contemporaneously to this meeting. However, in accordance with the emergency order, I am confirming that all members of the committee and select legislative staff have the ability to communicate contemporaneously through the Zoom electronic platform, and the public has access to contemporaneously listen and, if necessary, participate in this meeting by the Zoom platform or by telephone. All necessary access information has been made available in the House calendar and through the electronic calendar on the General Court website. The notice of this meeting complies with the House Rules RS and RSA 91-A. Anyone who has a problem accessing the meeting should call 271-3600 or email hcs@lake.state.nh.us. In the event the public is unable to access the meeting will be adjourned and rescheduled. I want staff that are on the meeting assisting us, Christopher Shea and Brad Greenland. Yeah, Brad is there. Please note that all votes that are taken during this meeting shall be done by a roll call vote. Let's start the meeting by taking a roll call attendance. When each member states their presence, please also state whether there is anyone in the room with you during this meeting, which is required under the right to know law. Representative Bernstein, you want to take the roll?
Thank you, Mr. Chair. Good morning, everyone. It is February 23rd, 2021. It's 9 a.m. Let's begin the roll call with Representative Pat Obrami.
Here in my home in Stratham. My wife's in the house. Thank you.
Representative Mary Griffin. Representative Griffin. Representative Jordan O'Leary.
Home in Hudson. Wife is in the house.
Representative Russell Ober.
Home in Hudson. I understand I can't mention cats, though.
Representative Doucette.
Home in Salem alone.
Representative Burstein is your clerk. He's in his home office in Nottingham, New Hampshire by himself. Representative Robert Elliott.
Present, and my wife is in the house.
Representative John Janigian.
Present in Salem, New Hampshire. I'm in my car, but I'll be in my home office in approximately 30 seconds.
Good. Representative Herschel Nunez.
Herschel Nunez is present in Pelham at home alone.
Representative Tim Baxter.
Thank you, Representative. I'm home alone.
Representative Walter Spilsbury.
Home alone in Charlestown. Wife and kids may come and go from time to time.
Representative Paul Tudor.
Home in Northwood. Wife is in the house.
Representative Almy.
Home alone in Lebanon.
Representative Richard Ames.
Yes, I'm here in Jaffrey. I'm at my home office alone.
Representative Tom Southworth.
Here in Dover alone.
Representative Malloy.
Here in Greenland, home alone.
Representative Schamberg.
In my truck in Concord, headed back to Wilmot.
Representative Tucker.
I'm here in Randolph alone.
Representative Gomarlo.
I'm here in Swansea alone.
Representative Tom Loftman. Representative Loftman. Representative Amanda Gorg.
Good morning. I am present and alone.
Representative Mary Hacken Phillips.
Morning, I'm present alone from my office in Concord.
Representative James Murphy.
Good morning. I am home in my office alone in Hanover. Thank you.
Representative and Chairman Norman Major.
Good morning. I'm in my home in my office and my wife is in the house.
Mr. Chair, there are 22 members present, 2 are absent.
Thank you, Representative. This morning, Christopher Shea was able to arrange to have the Deputy Director of the Health of the Public Health here this morning to talk about the COVID-19 and what effect it could have on our economy and various other things, and to answer questions from the committee. This is Tilly, it's yours.
Good morning, everyone. Thank you. Thank you, Chair Major. Thank you, committee members. I have some slides today, so I was wondering if I would be able to share them through screen sharing. Is that going to be possible?
Jenny, can you?
I'm gonna shoot this one to Brad. If she doesn't see the green share screen icon, then I don't know how to.
I got it. You just let me in, so thank you so much. So I'm going to inelegantly try and do this. I'm never quite good at it, getting it going, but we'll get it started here to the best of my ability. So I think what you should be seeing right now is a slide deck. Is that correct? True?
Yes.
Yes.
It looks right?
Yes.
Perfect. Thank you so very much. Well, welcome. Well, thank you so much for the second invitation. I am gonna plan on sharing some state and national trends and then shift into a little bit of a deeper dive into vaccines and again, focus on what this might mean for the economy. I anticipate that you're gonna have some questions. Some I will be able to answer and some I may need to get out a crystal ball for. So I'd love to jump right into the numbers. I'm actually gonna turn off my video while I'm doing the slides, simply for bandwidth issues. I'm coming to you live from our Public Health COVID Operations Center, which is not one of our regular buildings, and the internet is sometimes a little bit shaky. So I'm gonna stop my video. I'll pop my video back on when we have time for questions. So great, thank you so much. And I'm going to then jump right into the numbers. Here we go. So I think in front of you, you should have a slide with a little bit of national data. Although the cases have been trending downward across the country for some time after our post-holiday spike. Yes?
It's not showing. You haven't gone to the next slide.
Okay, thank you for letting me, my screen sharing has been paused. Let me just get, okay, here, if I can.
Slide 2.
Okay. Let's see here. I am not understanding why my screen sharing is paused. So I'm going to stop sharing. I'm going to start over and see if that will help. Okay.
Brad, can you help her out?
I was actually just about to suggest that she stop sharing her screen and try again. Might just be a glitch with Zoom.
Okay, here we go. We're going to try this again. No. For some reason, the Zoom is letting me know that it's paused and it won't let me share. So we're going to do this a third time here. Try to see if that is the charm. You know what? I will go ahead and just let you know the data that we have and see if we can do it that way because I don't want to waste your time today. So we'll see if we can get those slides in a little bit, but I don't want to waste your really precious time at this moment. So here, let me tell you a little bit about the numbers. So our cases have been trending downwards, as you know. And yesterday we passed really the solemn mark of 500,000 American deaths. This is about 100,000 more deaths than when the last time that I came to visit you, that you invited me to speak with you. And this number has actually impacted our life expectancy in the US. It's reduced it by more than a year. And certainly 500,000 deaths is not the worst case projection that was considered a year ago, but I think all of us would agree that it is definitely too many lives. And it's heartbreaking for those of us who have needlessly lost our neighbors, our friends, and our family. And the cost and burden to our communities and to our families cannot be fully measured in dollars or in this data alone. As we look at the New Hampshire data, you'll recognize, and if I had my little slide here, you would see the giant spike that many of us have been seeing on TV and in the media. And that occurred between Thanksgiving 20 and January 2021. The good news in that, as has been widely described, is that our active case count now is below 3,000, and our current hospitalizations are just above 100. This is remarkably different than where we were back in January, where we had over 300 people in the hospital at a time. We were really pushing the limits of some of our hospitals and some of our ICUs. We never got to a critical moment, but we really were pushing the edges of it and coming very close. So while the current numbers are still too high, we really are experiencing a relief to our healthcare system now. Most recently, you can note that the high rates of cases in New Hampshire are located in Strafford County. Many of those are associated with the university students that came back on campus. As I'll note later, UNH's testing protocol has helped identify those cases quickly, and investigations have indicated that those cases likely didn't come from formal class settings, but rather informal gatherings, you understand. You'll see that we also had higher rates in Grafton County recently. Again, similarly, many of these have been associated with the college. While the college cases are starting to go down now, again, great news, they have gone, and this mainly because some of those universities, UNH, Plymouth, have gone back to some remote learning. We could note that about even yesterday, about 15% of our daily case count was associated with a college or a university. Another thing just important for us to think about as you think about the current economy and the workforce, individuals ages 20 to 29 have both the highest cumulative number of cases of COVID-19 and the highest rate, and that's compared to other age cohorts. It's important to note that these cases are found among all working age adults. These are folks that work in our industries and in our businesses and then go home to their families. The good news is that the lowest rates are among the younger children. In addition to colleges, we continue to identify small clusters in workplaces. Workplaces such as manufacturing, restaurants, and retail continue to have small outbreaks. Some of the other good news, and certainly that we've all recognized, is the trend line among cases in long-term care facilities. We have the same pattern there. If I had my slides up, you would see the fancy graph where we spiked up in December and then started to come down in January. The downward slide, however, for long-term care facilities is even a little bit more impressive than the general public. And this is likely due to the vaccine efforts that began in December within those long-term care facilities with our partners in both CVS and Walgreens that work directly with those long-term care facilities. So that they have, the residents of long-term care have received both doses right now. Certainly if you had been a resident as of December or January, you've received both doses. And we're working on the continuation as new residents come in and staff turnover, making sure that those facilities have access to as much vaccine as they need. We are all very relieved to see that these numbers have started to go down among the most vulnerable New Hampshire residents who really were most at risk for the worst outcomes of COVID-19. So while we're feeling cautiously optimistic about the downward trends in daily counts, again, our counts are going down. We have 200 some odd cases today. We were routinely, just a couple of weeks ago, we were in the 300s and 400s, and even weeks before that, we were at 600, 700, 800 cases a day. So those numbers are starting to come down nicely. And we are very excited by the reductions in both hospitalization, the census in the hospital, as well as deaths, of course. We do know that we are in a race a little bit against the spread of those new variants. We all know that viruses constantly change over time and through mutation, and variants of a virus are really expected to occur. Sometimes these new variants emerge and disappear, and sometimes the new variants emerge and persist. Right now, we are focused on 3 major variants. B117 is known as the UK variant that I'm sure you've been hearing about on the news. Of the 3 variants, this is the one most prevalent in the US right now, with over 1,600 documented cases in over 44 states, including New Hampshire. The New Hampshire resident who was infected with this variant was an adult resident of Hillsborough County, and they had had close contact with someone who was diagnosed with COVID-19 who had been traveling internationally. Contact tracing was identified and close household contacts were also identified, but no community exposures were identified. All of the public health measures of isolation, quarantine, testing were followed, including the testing of all of the close household contacts. And so it's not believed that there was a risk to the community from this particular case. Quick testing and following those protocols helped contain the spread. In South Africa, there's another variant called the B1351, and it emerged independently of the UK variant, the B117. It was identified back in October 2020 in South Africa. We have 22 cases in the US right now in 10 states since early January. And finally, there's a P1 variant, which is the 3rd variant, and that one's known as the Brazil variant because it was found in travelers who were traveling from Brazil back in early January. Only 5 cases have been identified in the US so far. It appears that these variants seem to spread more easily, and some data is suggesting that the symptoms may be worse, especially among unvaccinated individuals. Data, especially from the UK, where the UK variant is widely spreading, is suggesting that the current vaccines, the Pfizer and the Moderna, are effective in reducing death and severe disease and hospitalization among those with the UK variant. So they may get it, but the symptoms are less. And really the things that we're most concerned about, which is hospitalization and death, do not seem to occur if people have been vaccinated with the current Pfizer and Moderna vaccines. So while all this data on cases is important, and those variants are important to keep in the back of your mind, I think one of the things that you're most interested in is an update on the vaccines. As we all know, we have been rolling out vaccine distribution since late December, and we have hit some bumps in the road, which again have been widely publicized. We have been actively trying to address those issues as they come along and keep readjusting. We have more than 4,000 people a day coming through our vaccine sites all across the state. We've redeployed state workers to answer phones. We've taken over empty mall space, where I am right now, and parking lots. We have specialized teams on meeting the needs of homebound patients, on individuals who have been disproportionately affected by COVID. We have a number of really focused teams trying to get to those folks that might be most at risk of not being able to access vaccine. And I simply want to note that we could not do this work without the National Guard, our healthcare providers, and our community partners. We cannot extend enough gratitude in their direction. They have all been extraordinary in helping us with the rollout that we have today. We are still in phase 1B, and we have some work to go in phase 1B. But as March draws nearer, we have our eyes and our planning hats all focused on the next phase, which is phase 2, which will include those teachers and childcare workers, as well as individuals between 50 and age 64. So again, 1B, we know that's the 65 and older group, and it's those folks that have multiple comorbidities. And that's who's rolling through our vaccine sites right now. As appointments and vaccine become available, we call people up on the phone and we get them in line. We've administered about 74% of the 324,000 doses that we have received. As of last Thursday, 12% of New Hampshire's population has received one dose, and about 5% of the population has received both of their doses and are now fully vaccinated. Each day, thousands more people are receiving that vaccine in the state. Approximately 37% of those eligible in phase 1A and phase 1B, which is the total number in those groups is about 438,000 people, has gotten one dose. So about 37% of that 438,000 people have gotten one dose. There have been a number of questions about what percentage of adults must be vaccinated in order to receive, get to some sort of herd immunity. Many epi models and experts like Dr. Fauci have suggested that it's something close to herd immunity occurs around 75% of individuals vaccinated. But even with these experts and the mathematical modeling, we unfortunately can't predict exactly what vaccination rate will be needed to return to sort of some sense of normal. There are just too many questions about the coronavirus that we simply cannot answer right now. And those questions are things like people who are vaccinated could still pose some small risk of spreading the virus, even though the vaccines protect them from serious illness and hospitalization and death, they still may be able to spread. We need to see the real world examples of what that might look like, not just the mathematical modeling. And because no vaccine is 100% effective, some vaccinated people may still get ill and could still pass on the disease. And then of course that we have the variants. So we have all of these things that are making, that prognostication difficult right now. Our governor stated last week at his press conference that he actually didn't fully expect that we would get to 75% of the population vaccinated, and that we probably should always expect to have some level of COVID within the community. But the good news is that with enough people taking that vaccine, we will see other data points move. We will see those daily case counts go down. We will see the number of people in the hospital go down and the number of deaths go down. And those are all equally important to the magic percentage of people vaccinated. Reopening will not necessarily be tied to just one data point. As all of these numbers go down and vaccinations go up, it's clear that we are protecting the most at risk, and we will begin to see more flexibility in how we can live, work, and play. Vaccine is one of the most important tools we'll have in the toolbox, but it is not the only tool. For the time being, we will still need to test like crazy. I think we saw that in the past few weeks at UNH in Plymouth, how important that testing strategy really is. It helps us identify where we have pockets and where we need to really focus additional effort. The testing allows us to isolate and quarantine folks to further prevent spread. We are currently testing somewhere over 8,000 people a day in a variety of settings. So our eyes really need to be on several metrics. Our eyes need to be on vaccine, new cases, hospitalizations, and deaths. And so while some of us have our eyes on that data, it's also clear that folks like our governor's reopening task force have their and also many businesses have their eyes on the summer. Guidance will soon be released for things like summer camp, which is pretty exciting for kids and families, so that our kids can get back outside and parents can have the childcare that they need. And I think that as this committee, you understand the childcare that families really need. Other guidance will start coming out of that task force soon, and with the governor's blessing around helping restaurants and lodging, again, continue to evolve and be able to serve their public and their clients and their customers. And as more and more we have more and more vaccine, we anticipate that people will be able to travel a little bit more broadly to the beach or to the mountains or to our main streets, which I know is what you all are concerned about. the vaccines begin to give us a little bit of freedom to do the many of the things that we really want to do and we have been missing. Outdoor activities this summer are still going to be the safest, but that's probably what we do best in New Hampshire. Even our performing arts venues are beginning to be incredibly creative to be able to produce the kind of events that are safe for both their performers and their staff and the public. Gopher funds and other supports have enabled businesses to adjust and stay on track and really be able to meet some of the things that they need to do with this guidance. Things like focus on their ventilation systems, focusing on changing some of the ways in which they also do their business. We've learned that things like childcare infrastructure is critically important if we want businesses and people to be able to work. I think as we plan for phase 2, again, for childcare workers and teachers and people 50 to 64, one of the main things that we have to do within the department and with our partners is shore up that registration system. Again, we've all known the hiccups that we've occurred. We have had to work with a clunky federal system. We've had to sort of build our system at the same time and make those systems talk together. And there certainly have been hiccups along the way. And so when we're thinking about getting ready for phase 2, we want that to go even more smoothly. And so we're putting in the effort round the clock right now, getting ready for that. The feds have also indicated that additional vaccines will be on the way. Johnson & Johnson vaccine should be available soon. You'll recall that's the 1-doser. It has a little slightly less efficacy than the Pfizer and the Moderna that we have now, but experts are really telling us that it's, first of all, any vaccine is better than no vaccine. And what's most important about all of these vaccines is the ability to reduce severe illness and keep us out of the hospital and keep us from dying. And Johnson & Johnson does that well as well. But it requires us to be thinking about different ways that we do the logistics around getting those doses out once they come here. We are currently considering ways to increase the throughput at our vaccine centers, especially as we wrap up the efforts for some of the most vulnerable people that are in phase 1A and phase 1B. We are looking at additional ideas of perhaps doing some indoor centers. We're starting right now this week up in Lebanon using an old JCPenney's that has been closed. We will be starting there doing indoor vaccination. We think that that will improve the throughput. We'll be able to get people faster through those indoor sites. And especially again, as we get to phase 2 and we have a broader section of population, we think that that's probably the best way to go. That'll be both safe and effective in getting the numbers through that we would like to get through, especially if we get more doses from the feds soon. So we're busy scoping out empty retail sites across the state, empty parking lots and others so that we can get things set up ready to go. You know, again, I want to say that the logistical support of the National Guard has been critical to our success. When you get your vaccine, as I hope many of you already have or you're planning to, please be sure to thank them and the volunteers and the first responders who have been helping get things rolling out and get those shots into arms. So I'll wrap up with just a reminder that if folks have questions, if your constituents have questions, to call 211. We know that there are sometimes long waits and we're sometimes put on hold for a little while, but those folks are working crazy hours right now to get in touch with everybody that they need to get in touch with. We're pulling people up earlier that had later appointments. We're trying to get them into earlier appointments. We're working with places like Amanuset Community Health Center up in Littleton, who just found out from the feds that they'll be receiving some vaccine. We've been working with Walgreens, who has also received some vaccine. And so we're really working in a coordinated way to get as many people through as quickly as possible so we can all have our eyes on what we hope will be a summer that we can get outside and we can get back to doing some of the things that we all love to do. So again, I will wrap up there. I thank the committee for asking us to come and do this update. You may have some additional questions for me. Thanks.
Thank you, Patricia. Your slides, even though we didn't get to see them, you send?
Yes, I'll send them along. I'll email them along.
All right, thank you. Questions for the deputy? Start with Representative Bromley, followed by Representative Almy.
Thank you, Patricia. Good presentation. So we're currently at 4,000 a day. Is that correct?
Yeah, between 4,000 and 5,000 a day, depending on the day. So, you know, like right after we had a snow day, our numbers bumped way up, you know, but it's somewhere in that ballpark.
So what's the goal now, though? You said that we're going to try to gear up so that we can do more than 4. What would that goal be? To be more than 4,000 a day?
Yes.
So what kind of a goal are we talking about?
I don't have that number right in front of me right now. I mean, what we want to do is move out as much of the vaccine that we get in every day. So we are dependent on what the supply chain is coming in from the feds. I think the numbers, you know, knowing that we have some promises for increased vaccine coming soon, the idea is to get to those other kind of sites where we can improve that daily throughput. And I don't have that number, you know, the exact goal for you right now, but we know that we have large numbers of people in phase 2 that we need to move through. And so that the current rate that we're going right now is insufficient. But again, it is limited by the number of vaccine we actually have.
Okay, thank you.
Representative Almy, followed by Representative Early.
Thank you, Mr. Chair. On 1B is reserving spots in May at this point. I know because I spent a long time on 211 and then got a very nice National Guard person who told me that and told me that there was absolutely no way that anybody who was more severely at risk than the general over 65 population could indicate that anywhere so that they could be called earlier. Mm-hmm. This is an answer I've been getting everywhere I've tried. There seem to be informal systems going on to allow people to sign up on local lists, and somebody local would then be able to call you when there was leftover vaccine. Those lists are accompanied by people saying, oh, we shouldn't be doing this because VAMS doesn't like it. My hospital, because VAMS doesn't like it, refuses to participate in anything like that. I do not understand, are we going to wait till after May to start going to 2, or is 2 going to start coming in the middle of 65 and older and keep people who really need it from being able to get it because they got signed up for May? And the other question, I mean, I'm in Lebanon. It's great news about JCPenney, but nobody here seems to know anything about that or how you would get people who need to be gotten, except for we do know under 65 works better, and that must be because you're using the state system rather than the VAMS system. But the VAMS system is really getting in the way of the people that need it most.
Susan, you have a whole series of questions there. You should probably wait until she answers.
They were all connected to each other and are the result of 2 months of real frustration. Thank you.
Thank you, Representative Almy, and thank you for sharing that. And we know, and we are distinctly aware of the incredible frustration that the public is feeling right now, especially among populations 65 and older, trying to get their vaccine and trying to, get those appointments moved up. We are actively every day taking people off the bottom of that, the way bottom of that list, the folks that have appointments in April, the folks that may have an appointment in May, reaching out to them and trying to put them back up at the top of the list as new appointment slots open. So, the switch from the Lebanon Armory over to the Pennies site, and I live in the Upper Valley as well, so I know that area quite well. It's a great location. We're really happy to be able to have it. Is really in preparation again for the time at which we are going to have more vaccine and more appointments available. We are committed to getting through this 1B group to the best degree possible before we take on more folks. And we are also committed to shoring up those systems, those database systems, so that people can have a better experience in scheduling their appointments and getting those appointments ready. I thank you for the time that you spent on 211. We know we have literally hundreds of National Guard and state staff right now answering those phones. And again, we know the lines are, the wait can be long sometimes, but they're very friendly and very helpful once you get a hold of them. As we know, we can't fully, we have to work with the VAM system. It's the CDC system. It's what's tied, we have to tie into that to some degree. So I don't have a magic answer for you right now, other than we are dedicated every day. We've got folks making phone calls one after another to try and move people up into earlier slots. We were able to move a bunch of people, a couple thousand people from those later slots into getting shots at Walgreens. Because Walgreens has gotten a federal contract to have some doses. So we're one of the only states that have been working hand in hand with our pharmacy partner to be able to take care of the people who are at the end of the list and get them moved up towards the beginning. So those are the sort of strategies that we're putting in place. The other the thing that you noted about people having informal lists, it's I know that there's been some confusion in the communities because our major effort has really been these state fixed sites. But we also have our public health networks in each of our regions around the state who are working within communities to try and get at some to places where people might not have as much access. So there are some different ways people are getting vaccinated. So those public health networks might be working with a senior center or maybe working in other communities and so in other working with a church there. So those folks have also been trying to get vaccine out the best as they can, but that's certainly not the overwhelming number of vaccines that are going out right now. So all I can say right now is that it has been imperfect. We are working on it 24/7 to try and make it more perfect and really dedicated to getting people off that bottom of that list and getting them vaccine sooner. Thank you.
Representative Yurley, followed by Representative Elliott.
Thank you. I have 3 questions. One, I'd like to know what your definition of a case is. When I was undergoing paramedic training, there was a very specific definition, and it doesn't seem to be the case now. The second question is regarding the UK variant that has been discovered. The way the press portrayed it was that it was rampant, found in New Hampshire. Oh my God, it's going to kill all, that kind of stuff. But I didn't hear anything from your office saying no, as you gave a very nice presentation here. These people followed protocol, and there's not believed to be any community exposure. I haven't heard that publicly. Perhaps it's not being done by your office. More likely, WMUR doesn't see a headline in it. And I haven't heard anything yet about a reaction rate to any of the vaccines that have been offered thus far, although nationwide and worldwide there's been as much as a 10% serious reaction rate. Have you noticed any of that in New Hampshire? Thank you for my questions.
Great, thanks. So you've got 3 questions right there. I'll start with the case number. So we use this commonly among our epidemiology groups and with CDC to describe people we count as having a particular condition. So in this case, COVID. We follow the national case definition for the COVID-19 infection, and that is set by CDC. So they create the definition, and we use that as that's what meets our case definition. There are other diseases and conditions that get counted similarly in this way, as like salmonella or tuberculosis. So it really is, it's our count, but what gets defined as a case, is a little bit more of a complex process of meeting the particular laboratory standards or other presumed standards. So I'd be happy to, I was just trying to pull that up. And again, I can't do 50 things at once right now, but I'd be happy to send you the case definition from CDC when I'm done off here of who gets counted in that. But we're really just using case as that. The case definition is just our count.
Personal edification, I would appreciate the definition being sent out. Thank you.
Yeah, absolutely. It's hard for me to do 2 or 3 things at the same time right now. So I'm going to follow up on your second question was, and I've just lost my train of thought again, because I was trying to Google while I was talking. Could you just remind me again your second question?
I apologize for that, but thank you very much. That was regarding the publicity.
The UK, the UK variant. So if you look to our press release that we put out when it happened, it actually did have some of that information in there, that there was really there was no cause for community exposure or cause for concern about community exposure, because in this case, people did the right thing. They were sick, they got tested. As part of that investigation, they noted that the person that they had close contact with had international travel. That also was part of what allowed us to do the detailed genomic surveillance on the test to see and to identify that it was the UK variant. So again, this is relatively good news. We knew eventually we were going to see one of these variants for a number of weeks. There were cases identified in Massachusetts, New York, Vermont even had one, I believe. So we were surrounded by it. So it was only time that we would find that case. So I agree. There was not a significant cause for alarm in New Hampshire. It's important to know it's an important piece of information for everybody to have, and just their awareness about why things like wearing masks is still important, social distancing is important, as well as vaccine. And your third question again, if you could just remind me real quickly.
Yeah, that was the reaction rate.
Oh, the reaction rate. So the reaction rate is, we don't have New Hampshire specific data at this point. So what will happen, and many of you who've had your vaccine might know this, you sign in, you're invited to sign up to something called VAERS, which is the Vaccine Adverse Event reporting system through CDC. I was fortunate enough to have my own vaccine. So you type in what how you're feeling every day and what your reactions are. I can say that we have not had any significant events at our testing sites of sort of immediate anaphylactic events. We have had some people that we've watched and we've monitored and we've connected them with their healthcare provider. But we don't have New Hampshire specific data yet around what the adverse events might be here in New Hampshire. The data that you were suggesting around 10%, is perhaps in the ballpark. And it also defines depends what you mean by an adverse event, whether it's a life-threatening adverse event or the sort of reaction that we all expect, especially after that second dose. The second dose punches a wallop, as the media has told you, and perhaps your friends and family have experienced. Some percentage of people will end up with fever, with soreness, with swollen lymph glands, with fatigue. It's been our experience that usually clears up within a day or so, 1 to 3 days, and that it goes away. I will personally share, I also got a wallop on my second dose, and it was 20 hours of feeling pretty punky, and then I woke up and I was fine. for many folks, that's a small price to pay for the benefit of vaccination. So thank you, and thanks for repeating the questions for me.
No problem. Thank you, Mr. Chair.
Representative Elliott, followed by Representative Murphy. Representative Elliott, you need to unmute. Representative Elliott, unmute yourself.
Okay, I did it. Thank you for taking my question, Madam Director. And I got my appointment because we state reps have a lot of pull. I got my appointment last week, and it's for April 24th, which by my way of counting is 2 months. So with all of the pull that we have, would you say that that's the normal time for people without pull to get an appointment? 2 months, is that correct? Do you have any statistics on that?
Yeah, we are seeing people, there's no magic way to get a vaccine. Unlike, to be honest, other states that have, counties and cities all doing different things. We have, for good or bad, New Hampshire has a much more centralized approach right now. What we are, it is not, unusual for someone to get an appointment date that is that far out. But what, as I noted to Representative Almy a little bit earlier, what we're doing is trying to pull people off the back of that list. As we have appointments pop open earlier, or especially if we have new vaccine, additional vaccine, we are trying to pull people off that later list and get them settled into an earlier appoint time. Every day I hear people say, yep, the National Guard folks gave me a call. So I really encourage everyone who gets a phone call on their smartphone and it says New Hampshire Health Department, pick up the phone because it usually means you've got some good news that they are trying to reschedule you. So hold tight. One of the things you can always do is try and call 211 as well. It's, as I said, it's a really, quite frankly, almost unacceptable wait time sometimes to get through. But if you have the time to sit, sometimes they can be able to help you with those appointments and see if there's a.
Excuse me for interrupting, but are you saying that yes, the normal waiting time is 2 months?
I'm saying that has not been unusual. So we have had people, when people signed up in January, we had people who got a test the next week.
If it's not unusual, then it's usual. So the answer is yes. Is that correct?
It is correct that some people have had to wait that long. It is also correct that some people have not.
Representative Elliott, she's answered your question. Please.
Thank you.
Representative Murphy, followed by Representative Nunes.
Thank you, Mr. Chairman, and thank you, Patricia. My question is more to do with the new state system. As Representative Almy mentioned, the frustration that I have experienced, but I think many of my neighbors and friends have experienced, is that there's a significant disconnect between 211, and those folks are great. They're very nice. The wait time has not been that problematic if you call later in the day. And they're very nice, but they're not helpful in the sense that if you have a second appointment scheduled, you have to change it or it is canceled for some reason, they will suggest you go back into VAMS and you could lose an appointment and then go into outer space into May, June, or July. And that's not going to be acceptable. So my question is regarding the new state system. Number one, when is it coming on board? Will there be a voice, a real person that you can talk to who can actually make an appointment and schedule an appointment for you, including the follow-up appointment if need be? Because so many people, like at DH and down in Boston, I know because my daughter got it, will they be able to, after you get the first injection, give you that on the spot, a follow-up appointment? So my questions really surround the new system coming on board. When and how effective and user-friendly will it be?
So we are developing it as we speak. We do not have a go live date right now because I think we've all learned that, and it's just good business sense not to launch something till it's ready. So we don't have a date for it to go live. We know that we need to have it ready for phase 2. I'm going to circle back and answer one of your other questions around second appointments. One of the things that has been happening now for the past couple of weeks is that you get your second appointment as you receive your first dose. So you're given that appointment right away so that you get within that 4-week window. So we've done some back end changing and been able to solve that problem that people were having earlier on in late January and the beginning of February, where they would have to go out and get back on VAMs, and the second appointment was 2 months away instead of the recommended 3 or 4 weeks. So we have solved that problem, sort of check mark that, and we will continue that as we move forward with the new system, so that second appointments should not be an issue. One of the, you've highlighted one of the features of the VAM system that we have not been able to get around, which is I have to cancel my appointment to see a new appointment. And that's certainly a piece of functionality that we're trying to work on the logistics. We have folks from Deloitte working with us and others so that we're ready to go and be able to have more flexibility for when we start enrolling the larger groups that are coming in phase 2. And also so that we can help the rest of phase 1B get their vaccine. So I don't have a go live date. We're working on it right now. It needs to be done before we go to phase 2. The follow-up appointments are taken care of right now manually the minute you get your first dose.
Good. Just a quick follow-up, if I may.
I
personally got my appointment, for tomorrow, but as soon as I found out on the 20th of January, or whenever it was, I got it 4 weeks ago, I went home that afternoon. I tried to make an appointment. I got it in Claremont. The earliest would be tomorrow. That was well before we knew we had the sessions going on. So, it's just difficult to rearrange through the VAM system. So the sooner that comes up and running, the better it's going to be for people logistically.
Yeah, we agree 100% that it's been a challenge. It's just been a challenge. So thank you. I appreciate that, and good luck on your vaccine tomorrow. You should get your second dose appointment right then.
Representative Nunes, followed by Representative Tucker.
Thank you, Mr. Chairman, and thank you, Ms. Tilley, for being with Ways and Means this morning. I have a question for you about continued vaccinations. Today, Johnson & Johnson goes before the feds today. They'll be presenting to Energy and Commerce about licensing for their vaccine. They have a promise of being able to deliver 20 million vaccines. This is a more traditional type of vaccine than what is being offered right now. And they also have a promise that they would have another 100 million ready by the end of June. Now, what I want to know from you today is New Hampshire in the planning for receiving this more traditional vaccine in our state? And if so, how would that be distributed? And will our residents have a choice of the type of vaccine that they can have? Will they be able to request it, or are they going to be forced to take a certain type of vaccine? And thank you.
Yes, those are great questions. Thank you, Representative Nunes. Yeah, the answer to your question is yes, we are planning tremendously right now, trying to get ready for what this will mean logistically when we have access to the Johnson & Johnson vaccine. And again, I think all of us know on this call, that's a 1-jabber, not a 2-jabber, like Pfizer and Moderna. So logistically, it makes things a little bit easier. And distribution can be, we can think about that in a much more broad sense as we move forward. We do not have a number yet from the feds of what our first doses might actually be. There's lots of conjecture out there. The industry has given some numbers, but we do not have a number yet from our federal partners of what that might look like. It certainly is a firm number of what those first allocations will be. To your question around how are we deciding and how are we planning, we're doing a couple of things. We have our folks that are doing the logistics of that within the department of what that might look like in our vaccine distribution. We've also been meeting with something called the State Disaster Medical Advisory Committee. It's called the SDMAC because every government agency loves an acronym. So the SDMAC has been meeting. They had an emergency meeting last week to talk about Johnson & Johnson, to really start weighing some of the ethical and logistical questions about who gets these shots. As I noted in my presentation, the efficacy rate is a little bit less in Johnson & Johnson. Experts are telling us that in reality, it's just as good as Pfizer and Moderna in terms of you don't get seriously ill and you don't get hospitalized, and the risk of death is very, very low. But it is, the numbers are what they are. There is a difference in terms of just prevalence and case prevalence. So that's entering into our conversations around what types of groups of people would be better suited for a Johnson & Johnson versus Pfizer or Moderna. And those are complex decisions, and I don't think we've landed on a firm plan moving forward. I think logistically it would be sort of difficult to drive through your vaccine site and sort of an array of vaccine were put in front of you, and do you want the Pfizer, do you want the Moderna, or do you want the Johnson & Johnson? That becomes complicated in terms of knowing how many appointments to schedule, and what happens if you're first in line that day versus last in line that day when we're dealing with such limited doses. So you've hit on all the right questions, and unfortunately I don't have final answers for you because we are in the midst of doing that work right now.
Follow up, Mr. Chairman.
Okay, follow up.
Thank you, sir. And Ms. Tilley, thank you for those answers. I want to clarify down to a certain point of, you just stated to us that logistically and looking at demographics, that you guys would be working to make choices about how those would be distributed. My question was about choice for the resident.
Yeah.
Will the resident be able to have choice of the type of vaccine that they want?
I think that's what we're working on right now, is figuring out what that might look like and how you could possibly make that happen. So I don't have an answer of yes, no, exactly how that would be done, because we're trying to figure that out given the small numbers we anticipate having, how you could, again, logistically make those choices available to folks, or what recommendations we would make for people. Are there certain populations we would recommend one over the other? This is a little bit different than, say, our flu vaccine right now, where you talk with your provider. There's several different ways to get flu vaccine, but there's enough product out there that you can choose them. And so, those are some of the limiting factors that we have in our planning right now, is how to manage some of the appropriate clinical choices that people would have to make, potentially with their provider's input, or just their own of what their preference is. They're, say you're needle phobic and I'm not going to get a vaccine if I got to do it twice, but you can get me once. And so that's what we're working on right now. These are really the tough questions and the tough planning that's going on today.
Thank you, Ms. Tilley.
Representative Tucker, followed by Representative Southworth.
Thank you so much for answering our questions. I never thought I had constituents who would write or email or phone, but I turned out to be wrong. This is, COVID has brought out the constituents. But I'm interested in getting back a little more to ways and means kinds of questions. Do you have any idea of what likely are apt to be the rules of the road, so to speak, in August? Do we think that they're going to be able to be larger weddings or gatherings? These are the things that, particularly in the North Country where I live, the summer season is a very important economic one. And people are wondering, should they be hiring people? Should they be taking reservations? And probably you're in one of the better positions to have an answer to what we can expect in August and September in the way of how distancing people have to stay, whether you think they'll still be asked to wear masks, whether large groups will be possible.
Thank you, Representative Tucker. And the audio was a little low on that. So I will, if I miss anything, please let me know. So I think you're asking a great question. And that's really sort of the crystal ball question all of us have, is what's the summer really going to look like? In some ways, I think we can be sure that we will still be thinking about mask wearing and social distancing to some capacity. So I don't think things will be 100% like it was in 2019, but the data is certainly indicating right now, as we continue to have the increase in vaccine uptake and the decrease in daily case counts and hospitalizations and deaths, that there may be some opportunities for some more flexibility than we had in the summer of 2020. We have been, the governor's reopening task force has been hard at work on this, thinking about what that might be. I know I've spoken with the Hampton Beach Chamber of Commerce as they're thinking about what sort of events, what they could be planning for. The notion that outdoors is best is probably something good that we can all sort of take to the bank at this moment, that, outdoors is better than indoors. But that there, my, guess is that there will likely be increased flexibility from where we were last summer. Where that line will be, we will work closely with the task force and the governor's office, and the governor, will have the ear of Dr. Ben Chan, and they will make some of those sort of fine line decisions about, what's the number of people that can be gathering together, or, exactly how things work. But, I'm taking great comfort in the creative planning that's happening among businesses everywhere. I've been working with some performing art venues, thinking about different ways that they do their work, whether it's a summer stock playhouse that is moving outside under a tent, but they're still doing a repertory this summer, which is unlike last summer when they were shuttered.
Thank you very much.
Representative Southwood.
Thank you, Mr. Chair, and thank you for taking my question. Following up for Ways and Means for our estimates, I'm concerned about a group that you didn't really mention today, and that is the group that refuses to follow any of the safety recommendations. We also have some groups who are not going to take the vaccine. And often it sounds like we're having an optimistic view of progress, which I certainly support, but we have people actively working against progress. And I think that must be hard for you to factor in.
Thank you. Thank you. And that is true. It is, we have folks that for whatever reason choose not to follow the common sense safety measures that we've all been following for the past year, wearing our mask, watching our distance, washing our hands, that same old tired, I think we're all tired. A year later, we all have COVID fatigue. We don't love it. But we know that if we want to get to the other side, we're going to have to do it. And, and right now, especially as we get towards the end of winter here, and we could sort of envision that there could be spring happening and summer, I think most of us are anxious to take off those masks. And especially as we get vaccinated, but it's going to be really important for us to double down and stay vigilant around some of those very basic things that we should all be doing in order to keep all of us safe, so that we can get those businesses open, so that we can go out and have those outdoor activities and, have time at the beach or time in the mountains, and, stop in and get a coffee at our favorite coffee shop, and make sure that we can. So, we anticipate that we're going to still have some things that are not normal, but, we need everyone's cooperation and vigilance to get us moving in the right direction. And really that means thinking about what you do in those informal groups. Businesses have done a tremendous job of adapting their business processes to be able to be safe for their employees and the customers and their public that comes in them. For the most part, they've just really done a great job. It's sometimes we get a little bit, when we are in among our family and friends in those informal gatherings, is, we found that that's really the time that we let our guard down and we take those masks off and we get too close. And that's when we begin to see spread.
Follow up?
Follow up.
Thank you. So just, again, you said it very well. We need everyone's cooperation to have this outlook for summer and so on, but we do not. And so it just makes me think for Ways and Means that the problem is going to go on longer because we do not have that cooperation.
Yeah. Yes, again, we have no magic crystal ball of what the exact amount of time will be, but we need everyone's cooperation. We've worked closely with, even health officers in communities and even our Attorney General's office to provide education to, business owners so that they can do the right thing. And we need folks to pay attention and really work together as a community for us all to move forward.
Thank you.
I have a question. You've addressed it once, the herd immunity. For the way things are going right now, the progress that you're making, and if it continues that way, when do you think we may be hitting the herd immunity point?
Great, thank you, Representative Major, Chair. It's unclear. As I've said, I think everything I've said today is unclear, so I'm a very unsatisfactory speaker for you today, I think. But the experts are saying something like 70-75% is the sort of classic sense of herd immunity to be vaccinated. We don't know how, I can't give you the mathematical formula for that because I don't know the amount of vaccine that we're going to have available and people's uptake of that vaccine. Those are the wild cards in that calculation. As I mentioned earlier, the governor is suggesting he's considering the fact that we may not get there, but that we'll have enough other protective practices in place to get us closer to, reopening some of those businesses or allowing businesses to have some more flexibility. So vaccine and herd immunity is an important tool in the toolbox, but it is not everything. As we were just noting, we're going to continue for, at least some time now that we're going to need to wear masks when we're around people that are not in our pod, and we're going to need to social distance for a little bit longer. In order to get through this, especially as we try and get those people vaccinated. I think some of the numbers, we're at 12% probably right now of New Hampshire being having at least one dose. That's a long way away from 70%, but we are, we have appointments every day for people getting vaccinated. And, our main goal right now is to get those most at risk vaccinated because that's, ethically and even economically and the impact to our healthcare system, we need to make sure that those most at risk are not in our hospitals or have the worst of the outcomes of COVID. So I'm sorry, I don't have a number for you.
Okay, one final question from me. That has to do with why isn't the public health system giving out examples more that if you don't wear a mask, this is what's going to happen to the surrounding air that somebody else is going to be breathing. I don't see any of that. But things that people have told me is that the droplets get into the air. They spread out. The more windy it is, the more they go. And that doesn't seem to be publicized enough. I think if it was publicized enough, people might change their mind about wearing masks. So why isn't it publicized enough?
Thank you for that question. I think we have tried, and certainly CDC has lots of great pieces of information out there. We know those respiratory droplets, I wear my mask to keep, you safe. It also provides a layer of protection for me. I think those droplets go out there and then they drop. Although we do know that there's still some aerosol that floats in the air, which is why things like ventilation systems are so important indoors. I think it's complex, and I think people do not like wearing masks. I think that's probably the most obvious thing I've said all day. People don't like it. It's it can be uncomfortable. Although I think many of us, can't even imagine right now a time where you look at a movie or a TV show and you see people in a bar or restaurant close together with no mask. It looks pretty foreign at this point of why would anyone ever have done that before. So I think you're right. I think we need to continue to stay on message and let people know what they can do to protect themselves. We certainly heard about a week or two ago, there was a little bit of a bubble in the media around double masking. And, some of the benefits that could be conveyed with double masking, especially of wearing a lighter sort of hospital grade mask, like procedure mask, not an N95, but the little procedure mask with a cloth mask on top of it, as we are, to provide perhaps even a little more protection with those new variants floating around. But you are correct, we may need to go back to the beginning and remind people why it is that we're doing all of these things in the first place.
Well, thank you, Patricia. That was a great presentation you made, and all the answers to the various questions, I think, will help out the committee here. I don't. Okay, there's one more hand up, Representative Elliott.
Thank you, Mr. Chairman. I want to apologize to Director Tilley for being so abrupt. That was most ungentlemanly of me, so I apologize.
I'm sure it's well taken.
Thank you.
Thank you. And you'll provide us your slides.
Yes, I will send those over to Christopher right when I get off, and I will provide that case definition for the CDC case definition as well.
Thank you very much.
Thank you.
Okay, now committee, we're going to have to get back to revenues. And Representative Gamalo, if you would
Yes.
have come in the DRA representatives so that
Okay.
we have specific questions for. And Chris, could you bring up your worksheet?
Yep, hold on one second. So the worksheet I just brought up is the same worksheet that Representative Major sent out yesterday to, I think, all the committee members. The only difference, there's three things that I adjusted. Where it said House Ways and Means low and high estimates, there was no designation of that was the Republican estimate, so I put that in there. I provided another row so that when the committee comes to an agreement, that it'll be clearly noted in the documents, and I bolded it. So you can see there's already some areas where the committee has come to some agreement on the revenue estimates. And then the last thing I did is I just renumbered the rows so that you can reference a row number, the bolded 1, 2, 3, 4, whichever one you might need to. So those are the only changes that were made to the document that Representative Major sent out to you yesterday.
Okay. I think we might as well go right to the business taxes, which is the toughest one. And in the data, we have the Republicans' estimates for the low and the high. We have the Democrats' estimate, which is the medium of their low and high. And then we have a line that says the governor's estimate minus the Republicans' medium, and then the governor's estimate minus the Dem medium, the Dem estimate. And then which shows that if you have a negative number, such as on line 21 at $600,000, which means the governor is less than the estimate. I'm sorry, it means the governor is higher. Sorry about that. No, it's less because it's the governor minus. So on line 14, the Republican medium is greater than the governor by 600,000. In line 22, the Democratic medium is greater than the governor by 5,100. Questions or comments? on what the estimate should be, or why the estimates are such as that. The $600,000 on the Republican medium is so darn close, but the $5.1 million difference on the Dems. Is there somebody that might want to explain that? Representative Almy?
And I didn't want to explain that. I was hoping to get some follow-up answers from the DRA.
Okay, we have the DRA here.
Yeah, we're talking about 21 at this point. So it's just a question about whether their original changes about taking the revenues down due to assuming that the extension payments and returns in March, April were going to come in lower. We're going to come in as lower than what they usually would do, because right now we're on track to some fantastic amount of money.
Somebody, the DRA, want to address that?
Sure. Good morning, Mr. Chair. For the record, Melissa Rollins, Senior Financial Analyst. I also have on here with me Devin Roderick, Financial Analyst, and Carolyn Lear, Assistant Commissioner. Thank you for the question, Representative Almy. I think I agree with you. There has been some great performance so far for business taxes. I think we are still hesitant at looking at what those returns and extensions may be. It's a little bit tough because we haven't been in this situation before with COVID, as you know. So normally we can pretty much correlate what estimates are looking like and tie that out to returns and extension payments. And we have a pretty good idea how the year is going to end and a pretty good way to model it. However, we are hesitant that, and what we've heard anecdotally, and this may be for some of the smaller and medium-sized businesses versus the larger businesses, is that a lot of the estimate payments were made based on estimate payments last year. And if that's the case, if these businesses did take a loss, we're going to see that true up come in March and April on these returns and extension payments. That may be the same for large businesses. I think we're still sort of keeping an eye on them, although we do know some businesses have been performing well. We do see the news articles in the online saying they've been performing well, but we just don't know how much of that is going to be offset by any decreased loss felt during this COVID period. So you are correct. I think I'd sent an email yesterday to you concerning this, that our low does have a reduction of 18% for returns and extensions. And that is based on some modeling we were able to do based on the last recession, even though I know they are not similar. So we did make some economic adjustments to match this session. So I think that is definitely our low, and we're feeling as more data comes in that low might be too low, especially with some of the offset that we've received this month. And then in our high, we still did account for a loss, but at half that loss at 9% for returns and extension payments. Again, I just want to know, we've worked with you for many years on revenue estimates, and this by far is definitely our hardest year to estimate this out. So feel free to ask any further questions or land where you feel it's necessary to land, because it is a challenging situation this year. We have nothing to model it up after.
Okay, let me say some words on the framework here. Is that it would be nice to be able to do a House resolution this week. If we don't finish this, then we won't do a House resolution this week, but we'll just give the Finance Committee a range. We have to remember that March and April are the ones that really tell us better than anything else what the revenues are really going to be for the end of FY21 And that would be the basis of going forward to FY 22 and 23. So we will be looking at the revenues and making adjustments every month. So if we give the revenues to House Resolution today, they will be adjusted on the basis of how the economy changes in a month, in April, and then in May, in June, and right up to the time we do the committee of conference with the Senate on the final budget passing. Because the whole thing is so volatile. One big thing we haven't even hit yet is that Congress is going to come up with a super stimulus package, $1.9 trillion. And we're not sure what that's going to entail. And that may throw everything out of whack. It may be for the good, I would assume, and for the bad, but we don't know that yet. But we will know that, hopefully, within the month of what Congress is passing. So the whole thing is volatile. But I want you to know that because of the volatility, we will every month be adjusting our revenue estimates. But we need to get something to the Finance Committee so they have a goal in order to set their expenditures. So what do we want to do?
Chair?
I've got a question.
Okay, Representative
Ames? Did you say Representative Ames?
Yes, I did.
Oh, I'm sorry, I didn't hear. This is a question about a single number or two numbers. And I say at the outset, it would be helpful to know if the Republican caucus is willing or ready, or whether we need to have a lot of conversation around this question of trying to reach to a single number. And then just a word or two about the Democrats coming forward with a single number. It's not that that we all agree. I think it's more that we all agree that there's uncertainty, and there's a lot here that sort of is beyond our powers of prediction. It's that crystal ball that was referenced in the previous presentation. There's so many different variables that come to bear that, and it's what DRA just said. They've never seen a year as difficult as this one, or a biennium as difficult as this one to estimate for. So I think we felt that a single number in the middle of the rough range that we thought was reasonable, giving significant weight to what DRA had done, because they spend more time on this and worry about it more. Perhaps we all worry about it. I shouldn't say that, but they have come forward with estimates that should be given credibility. So that's background for our moving to a single number. And I'm back to my original question and whether we can all get to a single number.
Yeah, and I think that's the way the Republican caucus would like to go, towards a single number. And then if that is different, then maybe we could split the difference. It's not going to make that much difference right now because there's so much volatility. And the numbers that we come up with for FY 21, they're so you're talking something like about $5.5 million difference. You split that. Now the middle would be $2.5 million. I wouldn't have a problem with that.
I wouldn't either.
Mr. Chair, this is,
Yeah. Brahman.
yeah, thank you. Look, we only have 5 revenue streams that are in contention, and each one of those is three numbers, 3 different votes. So we're talking about 15 votes. Most of them are pretty close. Democrats and Republicans are actually pretty close. So I'm in the camp of, with the exception of 23, fiscal year 23 business taxes. We have to have a discussion on that one, but all the other ones, I think we could just split the difference. I have the numbers. I took the Democrat average and the Republican average, add them together, divide by 2. For instance, for 21, that would be 107.5 million for 2021 for Republicans and 812 million for Democrats. So that average is 109.75.
You don't mean 109.
I would simply move, let's go with 109.75.
You mean
800.
809, I'm sorry.
Can I have a follow-up
Representative Almy.
before we move stuff? We had first, I would, if we were not going to a single number, I would go to wider ranges than what we had. So there is too much uncertainty. But we had at least 8 million worth of anomalies, I believe. Melissa told Representative Ames a couple of days ago in February, and they don't have anything to do with 22, but they are there in 21. And she was talking about maybe the 18% off was a little too much. I've been thinking about the PPE effects that we've already had. And though we are taxing them at this point, but the tax on them is pretty minor stuff for the amount they got. And I really think that the number in the middle is a lot closer to the one that the Democrats came up with than that. Thank you.
So are you saying that we don't look at both of them and split the difference?
Yeah, I personally would object to that. I think we're ending up on at least at what the Democratic estimate was, which is 12 million less than the high estimate from the agency. And the agency numbers are more recent and just affirmed as more recent than the governor's were.
You know, you can put 20 economists in a room and they make an estimate, and probably almost everyone will be a little different. And what do? They'll end up getting rid of the outliers and coming up with an average for one number. So that's the same procedure that I'm recommending here. Each caucus looked at these things, weighted all the evidence, and came up with their ranges, and with the range. And so the recommendation is, should we split that? Now, Representative Ames and I agree, but who would support that? Let me tell you, who would not, if you would not support splitting the differences between on the business taxes, let's say, taking the average of splitting the difference, the average between the Republicans and the Democrats, and splitting that difference. Who would not agree to that? If you don't want to agree, just raise your hand. Indicate by raising your hand.
I didn't hear the question clearly. Could you repeat?
And you can't see.
The question, again, maybe I need to talk louder, is that agreeing to taking the difference between the average of the Republicans and the average of the Democrats, splitting the, and taking that number as our first estimate, or one number estimate. And Representative Ames, you agree to that procedure?
Yes, I do.
Okay. And who doesn't agree with that procedure? Just click the raise hand function.
We click the raise hand if we don't agree with it.
Right.
We can't see more than 5.
Hold on a second. Well, the raised hands go to the top, and it looks like there's one raised hand.
So there's a single number you're asking us to agree to. Maybe you need to repeat the number just to make sure that people.
Okay.
It's
You're
about
breaking
one
up
off
just a
the
little
board.
bit in your voice. And so I think it's important that you repeat the number.
Okay. If we take the number, the midpoint of the Republican number,
Yes.
midpoint of the Democrat number,
Uh-huh.
and we find out what the difference is, and we split it in order to be able to come up with one number that both agree on. This is our first number. It's a preliminary number, but it's a number we're going to give for the House resolution.
Can you say the number?
Okay, and you did the average on that. Hey, Chris, would you populate what that number would be?
I
I
have
think that's important.
809.75, but,
I have that as well.
right,
So 809.75.
yep.
That's what I got as well.
So
May I point something out?
809.75. And we're going to call that 809.8.
I certainly can agree with that.
And then one of the things is who does, and then we'll take a vote afterwards on everything. But right now I want to show of hands who does not agree with that number going forward.
Do you want that in the raised hand function, or do you actually want people to raise their hands on the screen because we're still sharing a screen?
The raise hand function. And then we have one raised hand. So we'll go with the 809.8 for FY21. FY22, what would that be? We're a lot closer on this one.
Yeah, the Republicans are 825 million, or billion, 825, and Democrats are at 828. We're very close.
Very close.
So just take the average, that's 826.5.
And then on, now this one, it's going to be very wild. It's the most volatile that there is. Everything is going to get thrown at us. The result of the of the stimulus funds, the pandemic, and you name it. Nobody knows. We vary by $10 million. And I say, let's split the difference.
So I think Susan Almy has her hand up though.
Representative.
Thank you. On single sales factor is current law. I don't know whether you've included that in your thoughts. I included that and market-based sourcing from what the DRA sent in my thoughts last night. And I increased it for market-based sourcing. I decreased it for single sales factor. And I ended up with 835 again. So I really think that we need to specifically know that we are including single sales factor in there.
Melissa, would you give us your thoughts on including the single sales factor?
Sure. I know we've had a lot of emails going back and forth, and this is a tricky and tough topic. As you know, when we've looked at this before in the fiscal impact, it is indeterminable on our side. We've talked some about market-based sourcing and how we have a memo out there actually that I think you all have that talks about, we did look at a core sample of taxpayers, and I'll just explain a little bit with market-based sourcing, that in order to determine a fiscal impact for market-based sourcing, which went into effect on January 1st of this year, you really need to look at taxpayers' records because it needs to be audited and drilled down to see about those intangible sales. So we were able to look at a small group that represented a fair amount of revenue, and audit was able to drill down, and we did come up with an estimated impact of 10 million. However, that is a very rough estimate. I want to qualify that because there are a lot of factors that can play into that based on how many people are now coming in that we're gaining for market-based sourcing, and then how many people we are losing as those sales are now sourced to other states that were previously sourced to us. So market-based sourcing, I think we can say, we think will potentially be a revenue increaser at a minimum level. At how much, we're not sure. We did the 10 million estimate. It's rough, but at least we can give you that much. With single sales factor, it gets a little bit tricky. So that for current law is set to go in place on January 1st of next year, 2022. We also have a memo on that, which you've seen, and I believe we've sent around to everybody the latest fiscal impact that we did, which was in October. It's, again, if you look at it, tricky because one, we don't have market-based sourcing returns in yet to compare what the single sales factor will look like for these new taxpayers. We only can really do an analysis based on the old cost of performance method. So we did do that because we're trying to attempt to get some information out to you guys. And then looking at that, you can see that it does swing. In the first few years that we look at it, it does swing positive to negative, a pretty good amount. So in 2014, looking at it, it was a $9.7 million revenue increase. And then in 17, it was a $17 million decrease. And in 18, because we know there was a large increase in revenues, a large federal tax reform, repatriated returns were filed, it's a $68.2 million decrease in revenue. Again, that's under the cost of performance, not the market-based sourcing. And it's difficult to tell because of this swing and what the taxpayers are going to do in future years and what their sales are going to look like, whether it's going to be a positive or a negative. Based on what we've seen, it looks like it's a negative loss on more of the years than the positive gain. However, what that loss looks like, and if there will be a loss, is really indeterminable for us. We have no way to see it because of these two separate laws coming in hand. However, once we do have a year of market-based records in hand, we'll be able to look at those records and say what a single sales analysis would look like. So this one, is tricky. We don't have a definitive answer. We've tried to slice and dice it, and it's just indeterminable.
And we'll have better information come the end of April once the March and April revenues are coming in, but still it's going to be dicey. And I'd rather be on the conservative side on this. And I'd go along with splitting it right down the middle. So there's $10 million difference, so it'd be 20, right down the middle would be $26.1 million. And then what would that final number be, Pat?
I got to calculate it because I was gonna, if you think that's okay, we'll go that way.
Well, let's see what the number looks like.
All right, that's going to be splitting it down the middle. Okay, so Republican estimates are 845. Democrat at midpoint is 835.
840.
Yeah,
there
it's
you go.
840.
840. Right.
Representative Major,
Yes.
could I ask, would you go to the floor with an explanation that this includes some idea of the losses that could be there to single sales factor, or are you going to ignore it entirely? Because I do believe that it is likely that the situation will be like the 18 one, with major corporations having major profits, and that there will be losses. And we are trying to get the Senate to delay implementation till we know what we're doing, and being able to go to the floor, including that in the estimate, would help with that regard. Thank you.
Right, and delaying won't affect what we're trying to do right now, because we still have to use the current law. But anyway.
Yes, it's the current law. So the current law says that we are more likely than not to be losing revenue in 2023 due to that factor by itself.
Yes and no. And you and I can talk offline on that. But I think with the two caucuses, we agree it's a good agreement. Who doesn't support this number of 840? Then we'll move on to meals and rooms. Meals and rooms, the difference between the midpoint of the Republicans and Democrats is $2 million. And if we split that, what would be the result? Pat?
301 million. Is the number.
Okay. And
302 for Republicans, 300 for Democrats. Averages to 301.
Okay. And then we're in agreement on the FY22. And that
we both came in at 328. Yes.
And again, we're so close on FY23. The difference would be 13.7.
So the average is the Republican number is 350, Democrat number is 349. So the average would be 349.5. I mean, we're almost identical.
Okay, let me see. Does anybody have a problem using these numbers? Okay. Next is the tobacco. Tobacco, the difference is $2.5 million between the Republicans and the Democrats. If we split that,
The Republican average was 246.5, and the Democrats were 249. So the average of those two is 247.75.
247.8.
28, yeah, okay. Wait a minute. Yeah, 247.8, yep.
And I mean, there's a very small difference on FY22. So what would that result in?
244.75, 244.8.
Okay. In the same way, there's a $3 million swing.
So the average would be 240.5.
Okay. The liquor transfer, we're in agreement. We'll go back to okay, fine. And then interest and dividend. We're pretty close. It's 500. It's a $500,000 difference.
Yeah, it's the Republicans are 128.5, the Democrats are 129, very close. So the average would be rounding up 128.8.
And that would be there's a $500,000 difference there.
Right.
Should be 130. Do you have a number on that, Pat?
Which one, are you on the second year now, 22?
You're on the.
For fiscal 22?
Yes.
Okay, so Republicans were at 136 and the Democrats were at 137. Again, very close, a million off. So the average of those would be 136.5.
And then this is the out year again. It's
Yeah. So the out year, the average would be 138 even. I think the
communication.
Republicans are like 137, Democrats are 139. So the average is 138.
On the interest and dividend, yeah.
On the interest and dividends.
Yeah.
Year.
Now for the communication, it's same for everybody.
I think we're all agreed.
Yeah. And then for real estate, there's a $500,000 difference between us.
Yep. Republicans were at 191.5. Democrats were at 192. You know, again, very close. So the average would be rounding up 191.8.
Two and a half spread. So you. Three and a quarter. It would be 180.25, is it? 180.3?
Yes, 180.25 or
Point.
180.3, yep.
And we'll split the difference on that.
Right. Then the last number is 23 for transfer. Republicans were at 170.5 for their average. Democrats were at 167. So the average rounding is 168.8.
Okay.
And those are all the numbers.
And then I will go over to that populates all of them. Any questions or comments on what we did on coming up with the numbers for the House resolution?
Great job, I think, with all of the different factors. Really, I think we did about the best we could.
And we're going to have to do it again and again and again as we get more and more information. So then we need to take a roll call vote on this. So,
Representative Major, this is Chris.
Yes, Chris.
Did you want to do a roll call vote for each of the funding sources, or did you want to do one vote at the end for general fund, education trust fund, highway fund, and fish and game?
Oh, yeah, right. It was, okay, I'd rather do the whole bit at once. So we go to the highway fund. In the highway fund, the Republicans are going to accept the agency numbers, and the Democrats, are you going to accept the agency numbers also? Representative Almy?
I believe that's what we said. Somebody remind me if we had any quibbles.
I don't think we had quibbles. I don't think we spent time on it, but if somebody had a quibble, we would have spent time on it.
Okay, then.
Yeah, we did look at it. I did.
Okay, fish and game.
And fish and game, the committee agreed to last week to the numbers that are in here.
Okay, so we have the numbers there. Anybody want to make any changes? Then let's just look at the total. The fish and game.
Sorry.
Let's go look at the total for the general and education trust fund. If you can, yeah, that's it. So that FY22, the total comes up to be 2.674, 2.725, and that's a growth, 2.755, and that's a growth. Relative to the governor's number, we don't care. Whatever it will be. These are our numbers. But for the sake of comparing, let's look at those comparison numbers that are in there.
Is that what you're referencing, Representative Major?
Yeah. We didn't do a comparison on our numbers that we just came up with today. So. Does anybody have any changes that they want to make? once more, any changes that you want to make? Then I'd like to have Representative Bernstein call the roll. So the roll will be to accept the estimates that we have for the General and Education Trust Fund, the Highway Fund, and the Fish and Game Fund.
I'll stop sharing my screen so you can do that.
Okay, Representative Major, do we need a motion or just go right to the vote?
We need a motion.
Okay, I'll make the motion.
Okay.
Who wants that motion?
I second it.
Who made the motion? Representative?
Bernstein made the motion.
Okay, second by Representative Ames. And the motion is ought to pass with the General Fund and Education Trust Fund, the Highway Fund, and the Fish and Game Fund. All in favor, when your name is called, will say yes. If you disagree, say no. Representative Bernstein.
Thank you, Mr. Chair. Let's begin the roll call vote with Representative Abrami.
Yes.
Mary Griffin. Representative Griffin. Not voting. Representative Ullery.
Yes.
Ober.
Yes.
Bernstein votes yes. Doucette.
Sorry about that. Yes, man.
Yeah, Fred, can you show me your face?
Absolutely.
Don't make me sorry I asked. There you go. Thank you, sir. Representative Elliott. You're on mute, Bob.
Yes.
Thank you. Representative Janigian.
Yes.
Representative Nunes.
Yes.
Representative Baxter.
Yes.
Spilsbury.
Yes.
Tudor. Representative Tudor. Say it one more time for the record. I'm going to record your vote as yes. Representative Almy.
Yes.
Ames.
Yes.
Southworth.
Yes.
Malloy.
Yes.
Schamberg.
Representative Schamberg votes yes.
Tucker.
Representative Tucker votes yes.
Gomarlo.
Yes.
Loftman. Representative Loftman. No vote. Representative Gorg.
Yes.
Hacken Phillips.
Yes.
Murphy.
Yes.
Chairman Major.
Yes.
Mr. Chair, the vote is 22 in favor, 0 opposed, 2 members did not vote.
With the vote being 22-0, the motion of ought to pass passes.
Who, I'm sorry, who made the second on that motion?
Ames.
Representative Ames.
Thank you.
Well, I thank everybody. This is not easy, but we have to come to a compromise. And we know we're going to get a number of more bites of the apple as we get more information. And hopefully, as we get more information, it's going to be positive. We've had enough negative information to last a lifetime over the last year. Anybody else want to make any comments? If not,
Yeah, I thought it was very helpful to have someone from the Department of Health and Human Services that, although I didn't like hearing what she had to say sometimes, it was very helpful. Thank you for pursuing that.
she knew her business, didn't she?
Yes.
And
she was willing to take the slings and arrows.
yeah, when I talked to the commissioner about getting somebody, and she was sent a real good present.
Now that was really good. Thank you.
Any other comments from anybody? Then
Norm, I have my hand up.
I do have a comment. If any of the bills that we have on consent calendar gets pulled off, those that made the motion, and I've sent your name in, get up to speak to defend that bill. And then I'll do the PI. Hopefully, we won't have any of these bills pulled off to consent, but be prepared as if they're going to be pulled off consent. And then next week, on Tuesday and Wednesday, all the remaining bills that we have in our possession, we are going to have a work session, and those that we can take care of on Tuesday, we'll exact them out. And we need a further amendment for that, and we'll take care of them on Wednesday. Of those that we feel that we don't have enough time to fix them, and we would like to work on them, and we'll vote to retain them. And those that we don't like, we'll just vote to hightail them. But the discussion that people have had on House Bill 15 has been a very interesting discussion. It's led to areas that I hadn't considered myself. And so I think we're almost there. So, any questions?
Norm?
Yes, Representative Romney.
So let me ask Chris, do you think when will OLS have this ready for us? Probably.
So the intention is to give them a draft resolution by noon today.
Okay.
I've already talked to them last week, and they've got a shell LSR set up in the format that your resolutions typically are. So I expect it would be fairly quick this afternoon.
So it could go tomorrow then.
Some of that depends on how many amendments and other things that they're drafting right now related to the session or other committees that are doing work. So that's the one factor. But I did let them know I needed something by the end of today so that Representative Major could have that and take a look at it and share with whoever he needs to share with, and then coordinate getting it on your agenda for
Intention is to have it
Thursday.
For Thursday. Right. And then I would like to have Representative Elmy with me make that motion.
I would be happy to do that. We're going to be in opposite ends of the hall, it sounds like.
We'll work it out.
Middle.
Doesn't sound like a hall, it sounds like a field.
Yeah.
All right.
No, so for the new member.
Any questions?
Yeah, I got a question, not a question, a comment. So tomorrow, when we do consent calendar, pay attention after the consent vote, because then the clerk is going to start reading off names of committees that the second committee bills are going to. So I usually try to keep track of how many bills we're going to get when off the consent, and then after each one of the bills is passed out of the other non-consent bills after the debate, and if it passes, then the last thing the speaker will do is say this bill is going to Ways and Means, or this bill is going to Finance. It'll give you a pretty good idea how many bills we're going to have to deal with in the next couple of weeks. That's all.
Patrick, if you could get the clerk to do what I could not get the clerk to do and read off the name of the committee things are going to before he reads off all of the numbers of bills, that would be so helpful.
Right. Which committee first, and then, right. I will talk to him in the morning.
Good suggestion. All right. Then we'll see you all tomorrow in person. Great. Thank you, everybody.
Thank you, Mr. Chair.
Thank you, Mr. Chairman.